Good morning, everybody. My name is Florence Nachito. I work with the Horticulture Exporters Association.
Good morning, everyone. I'm called Wanango Evelyn. I work with Uganda Sugar Manufacturers Association and representing the sugar sector.
Charles Bazare. I'm from Uganda Clays Limited. Thank you.
Yeah, there are some, not all, there are some private sector investors who are using the young people as a way of attracting clients and customers to their business, but in the process, putting the young people at risk, especially the risk of acquiring HIV. Many of them are not aware that they are putting the young people at risk, but importantly, as Uganda AIDS Commission, our interest is in seeing that whereas your business is growing, the young people are protected from acquiring HIV. So what we do is we interface with the business leaders. We tell them about the available technologies for HIV prevention. We support them to ensure that these young people acquire the knowledge, but also are protected in delivering their services. And if there are activities that are putting young people at risk, certainly we dissuade the investors from exposing the young people in that manner.
Stella, I work as HIV AIDS and Gender Coordinator, Services Limited.
When are you supposed to
Thank you. As Uganda AIDS Commission, we provide overall development of the policy, guidelines, and coordination of the response. Now, we've developed what we call the national partnership mechanism, and this manual outlines different roles and responsibility of each of the sectors. We have 14 HIV response partners. Private sector is one of them. So when you look at the roles that are outlined there, one, they're supposed to mainstream the HIV within the sector, mainstreaming for the internal staff who are working in these private sector entities, and also the general community that they interface with. Look at the road construction. We have the workers who are there, but also the communities. So the guidelines specify what are the roles that they're supposed to. They're supposed to provide support to the people who are living with actually HIV, who are working there. So it's actually clearly outlined in this sector, in these guidelines. They are supposed to make referral. If a worker is actually sick or living with HIV, they are supposed to be actually refer this worker to the health facility and provide, psychosocial support to them. Also, it talks about how do we mobilize the resources. We are not only talking about money, but human resource that can actually work. They are supposed to set the committees that would help them to report on different activities. As you saw here, we make reference to what Tororo Semen is doing within the communities where they're actually operating. They have a plan, they have resources to support this, they have interventions that will provide services to actually their workers. They disseminate the messages. So we want all the private sectors in the country to implement these activities that have been actually defined in the coordination guidelines. But as I said, we have the 14 structures of the HIV response partners. We have parliament, we have government ministries, departments, we have people living with HIV, we have research, academia and professionals, we have the media, we are actually working together, we have people living with HIV, we have civil society, we have private sector themselves who are actually here, we have AIDS development partners, we have youth, women, and person with disabilities. These are the structures that we've actually brought. So when you look at this structure, this is the groups that will enable us deliver the target of ending AIDS as a public health threat by 2030 in implementation of this activity to achieve zero new infection, zero stigma, and zero AIDS-related death by 2030.
which will be done by the Director Planning and Strategic Information, Uganda AIDS Commission.
1992 to coordinate, oversee the national HIV and AIDS response in this country. So we work with all the sectors, be it government, be it private, being parliament, local government, civil society, people living with HIV, media, and we are very pleased with the media team who actually was asked here. And we have brought in the new constituency. I know my sister, we used to have 12, but now they have actually increased to 14. We have brought in the young people and persons with disability. You will actually see. Our vision is to have a population free of HIV and AIDS effect. We want people to live healthy, productive. Even if you living with HIV, you should be actually very productive at the workplace. I know some, not many of you are here. People would actually say, you know, you're living with HIV, you can't add what actually happened in Oima, in that construction site. I'm just giving those examples, but there are very many. But we're saying we need to have a population free of HIV and AIDS effect. Nobody should be stigmatized. And our mission is to provide effective leadership for the HIV and AIDS multi-sectoral response. The multi-sectoral I've mentioned, and I will still under it aid to see how the private sector can network with all these HIV response partners in the country. I'm pleased to welcome actually our former board chair. Once a general is a general, so he's actually our former board chair, board member, who actually worked with us in the production of some of the policies that we are actually implementing today. And I'm pleased to see you because you are out of the country and you flew in and actually joined us actually this morning. So you're welcome. You found people have introduced themselves. We'll give you opportunity with other new members who are coming actually on board. Members, Uganda AIDS Commission, as I said, we coordinate the HIV response using the multi-sector approach. We don't offer services. I know other members would actually ask, where are the testing kits? Where are the condoms? I know the issue of the lenacapavir, the injectables. People would actually ask, no, we just coordinate all these other groups. We don't offer those services, but we'll be able to coordinate who is actually providing these services. Then you'll actually be able to access all those services. As I said earlier, we work through the multi-sector. We don't work alone. We work with everybody, and that's why we're here. And as Uganda AIDS Commission, we established the 14 HIV response partners to help us coordinate. I will start with the one in the room, the private sector organizations. And as the chair said earlier, private sector will want to bring you on board. You are the engine for the national development. And when you look at the NDP4, the issue of private sector is actually very key in the NDP4. So we need to work with you in ensuring that we mainstream the HIV so that we achieve the presidential directive of ending AIDS as a public health threat by 2030. And we'll define what ending AIDS by 2030 means so that when we go down in our entities, we're able to articulate, we're able to, everybody would actually understand. During the review, different stakeholders made a recommendation that the private sector, using all the stations, the private, the manufacturers, the bankers, sugar, we work together. I know very many young boys, they work that side. We'll see what is actually happening. And my good friend said that the leading, we will see how women streaming the HIV in all those actually places. I know APSA, we are going to make a run on the 17th of this month. So these are all people we need to bring them on board for the right cause. So members, I will make a presentation on orientation of the corporate companies in Uganda on HIV mainstreaming, ending AIDS by 2030 in Uganda as a public health threat. I know people will be wondering, are we going to end AIDS as a public health threat by 2030? Yes, and it's very possible. Commissioner, you're most welcome. So I will talk about Uganda AIDS Commission, who we are. Uganda AIDS Commission is a government agency established by Act of Parliament.
Good morning, everyone. I am Brian Masimbi. I'm the data manager, Uganda AIDS.
Good morning, ladies and gentlemen. I'm Hope Murungi from Uganda AIDS Commission, coordinator for private sector and civil society.
Thank you. You got a
Good morning, members. I'm called Namaganda Stella. I work with Dot Services Limited, a private company.
I am Dr. Vincent Bagambe, Director Planning and Strategic Information at Uganda AIDS Commission. Today, Uganda AIDS Commission is interfacing with the leaders in the private sector, coordinated by the Private Sector Foundation of Uganda. As Uganda AIDS Commission, with the mandate to coordinate the national HIV response in Uganda, we have the responsibility of implementing the Presidential Fast Track Initiative to end AIDS as a public health threat in Uganda. And in this regard, we work with multiple stakeholders. We have many stakeholders, each one playing their different roles. We have, of course, the Ministry of Health providing HIV services, but also we have the social sectors, the cultural institutions, the religious institutions, and now the private sector. We are interested in the private sector for many reasons. One, because they are the biggest employer in Uganda. They employ the biggest number of people, most especially the young people. And as you may know, when we look at new HIV infections, most of them, over a third, are occurring among young people, especially those aged 15 to 24 years. So if we are working with the private sector, we will be able to reach those young people with information and equip them with the capacity to prevent or protect themselves from acquiring HIV. But also the private sector, we are looking at the private sector as the key engine of economic growth in Uganda. We know that in the next 10 to 15 years, the private sector will, most of the resources that are used in the country will be from the private sector. So with the reduction in donor funding for the HIV response, we know that the private sector will be playing a big role in provision of these resources.
Doctor, we see that
your name, the organization you work for.
Thank you very much. My name is Prudence Asovola, and I'm representing Secure Uganda.
My backbenchers here.
Good morning, I'm Winnie Ainebabas. I'm a journalist from UBC TV.
Good morning, everyone. I am Katongole Moses, working with BPS Telefine EAFI.
We have the medias in the house.
This commission, Uganda AIDS Commission, kitongole kya gavumenti kirina obuvunaanyizibwa okukunganya ebitongole ebirala okutwaliza wamu okukwatira wamu okulaba nti tulwanyisa akawuka ka mukenenya. Olwaleero tulina meeting na mikwano gyaffe baneekolera jange abeekozesa private sector kubanga aba private sector balina kinene nnyo kye basobola okukola mu kulwanyisa akawuka ka mukenenya. Ekisookera ddala banagaga balina ssente, ate ssente ezo tuyinza ozikozesa ffe wamu nabo okulaba nti abantu be bakozesa, abantu abafuna services okuva mu private sector, abantu be batwalira ebintu, be badistributingako ebintu, bonna bafunye okutegeezebwa obuzibu obuli mu kawuka ka mukenenya. Ekisooka nti mukenenya kyaliwo, tavangawo, naye ekyokubiri nti waliwo obujanjabi weebuli ate n'ebyokukozesa weebiri okwewala okukwatibwa akawuka ka mukenenya. Ekyokubiri aba private sector singa tukolagana wamu nabo waliwo services nabo ze basobola okuweereza abantu naddala abakozi baabwe okulaba nti baba protectinga oba beewala okukwatibwa akawuka ka mukenenya. N'ekirala okulaba nti bwe baba balina omuntu gwe bakozesa bamuwa chansi okugenda okufuna obujanjabi oba okukebezesa okulaba oba alina akawuka ka mukenenya oba talina, n'obuweereza obulala bwe tuwa abantu abali mu bwetaavu. N'olwekyo tulina okukwatagana n'aba private sector okulaba nti ebyo byonna tusobola okubituusa eri abantu ababyetaaga.
Omuwendo mugambe gukyali mulimuko mu bitundu Uganda, Uganda n'Embale obukyala ogw'abantu abakyalina ssimu. By 2030 vision yammwe yeneetuukira? Katuwe twogerera mu Uganda mulimu abantu akakadde kamu n'ekitundu, 1,500,000 abalina akawuka ka mukenenya. Abantu abo kati ekigendererwa kyaffe kwe kulaba nti bafuna obujanjabi ne basobola okwebeezaawo ate nga bali ekyomugaso eri gavumenti. Naye ekikulu nnyo ffe ng'aba Uganda AIDS Commission twagala nti tu protectinga abantu, tukendeeze enamba yaabo abafuna akawuka ka mukenenya obupya. Essaawa eno buli mwaka tufuna abantu 3,700. Twagala nti we tunaatuukira mu mwaka 2023 abantu abafuna akawuka ka mukenenya nga bakendedde nnyo bali wansi wa 1,000. Kati bwe tuba tugamba nti we want to end AIDS, tekitegeeza nti abantu tebajja kubaawo mu Uganda nga balina akawuka ka mukenenya. Abo abakalina already tujja bajanjaba era bajja kubaawo, naye ekikulu kwe kulaba nti abapya abatanakafuna tebakafuna. Ate tulaba nti singa tukwatira wamu aba private sector nabo ne baplayinga paati yaabwe, abasawo ne bajanjaba abantu, abeekanisa n'amalamizo amalala nabo ne bakola ogwabwe, abakulembeza ab'obuwangwa nga Kabaka kye yakoze mu misinde mu mazaalibwa ge nabo ne bakola ogwabwe. Lazima emyaka 2023 akawuka ka mukenenya oba AIDS tujja kuba tugimazeeko. Kati bwe tuba tulambula mu bitundu twesanga nti mulimu banagaga, bananyini business, ate abakozesa abaana baffe mu milingo emikyamu mu bukyamu. Okugeza waliwo etawuni emu gye twagendamu mu Western Uganda eyo ne tusanga nti banagaga banamabbaala
balina abawala bagenda ne bafuna abawala ne babateeka mu mabaala kubanga abawala bato balabika bulungi. The revelers baje mu mabaala gaabwe kati be bava wano ate babatwala mu baala eddala eyo nayo balabikayo nga abapya. In the process bakasitoma bo baba beeyongera nanyini bizinesi n'akola ssente, naye ekizibu kye twasanga nti abawala abo ate bajjamu okubakozesa. Abalala ne batuuka n'okwetunda, osanga nga beetunda, kwegamba nekibateeka mu buzibu obw'okukwatibwa kawuka ka mukenenya. So kati ffe nga Uganda AIDS Commission nga tuyitira mu bitongole associations eza baanagaga nga zino, tutuukirira abo bananyini business ne tubabuulirira ne tubayamba ne tubalaga wawe basobola okujja, abasawo abasobola okukebera abantu baabwe, we basobola okujja kondom n'ebirala ebisobola okuyamba abakozi baabwe okubaziyiza okukwatibwa kawuka ka mukenenya.
At least the ones which are here are from the private sector. Before.
Yes, I'm called Tometi. I work with Uganda AIDS Commission as a director partnership. We coordinate the HIV response in this country with the agenda of ending AIDS as a public health threat by 2030. We are engaging the private sector today in Hotel Africana to ensure that we want the private sector to come and support the agenda of ending AIDS by 2030 as a public health threat. You know, private sector has a wide spectrum in this country, and their intervention is actually very critical, and that's why we want them to mainstream in all the sectors under the private sector in this country. One of the critical things is we have to ensure they have a work plan, the workplace policy, and they also provide resources to fund some of these activities within the entities, but also within the communities actually they serve. We look at the factories that we have in this country. We have young girls, young women who are actually working there. And once we address the risk factors within these industries that we actually have in this country, we'll be able to provide effective coordination of ensuring that the HIV and other health-related issues are addressed, so that we have a very productive, effective human resource that can promote the national development.
Artisanal dancers, we have manufacturers, we have bankers, we have the media, which is very, very important. I was reading through the guideline and I realized that
I start. I'm called Namaganda Stella. I work with Dot Services Limited. Dot Services Limited is a construction company. It's a construction company. We are dealing in different constructions, roads, bridges, buildings, power. We've been in this prevention of HIV/AIDS for the last 20 years, and we normally prevent mostly with our workers and the community members around our projects where we work from. What exactly do I do? I'm the HIV/AIDS. The company, it is a construction company, yes. We carry out community sensitizations, HIV/AIDS testing and counseling. We provide condoms for the workers, and we normally do this community sensitization and outreaches after 3 months. We normally do that. We provide these condoms on a monthly basis, and we normally do ISC distributions. These ISC distributions have information concerning HIV/AIDS, STDs, and gender at workplace. And we normally have the community gathering where we involve in CBOs to guide us in what is happening in the Ministry of Health. So the company has been there for all its workers in different districts where our projects are, not only in Kampala. Right now we are having in Kampala, and we are carrying all the same activity. We are having so many projects where we are carrying this HIV prevention, and we normally do it on a monthly or quarterly basis. Yes.
Disabled. So for us to have effective coordination,
as a private sector, dot services use its own money. Take an example. We try to use the government hospitals where our projects are, but they were understaffed. They could not cope up with the population of workers we have. So we went private, and in connection with Uganda, Reproductive Health Uganda, we partnered with that organization to carry out the HIV/AIDS testing, counseling, and the distribution of what? Of condom. In line with private still, we connected with Federation for Ugandan Employers. They also help us. We pay them for their services, and they bring us their services. So it has been giving out by paying them to bring to us the what? The service. Yes.
Lesson for us to deliver and sustain the structures that we have built. But this one can always be communicated.
Good morning, members, for coming. I know it's actually raining outside. People are still inside the car, but let's begin. Others will actually get us on the road. Once again, my name is Tom A.T. I work with Uganda AIDS Commission as the Director Partnership, who is in charge overall coordination of what we call the HIV response partners. And in this particular engagement today, we have the private sector. I was very pleased with the introduction when we were making those introductions, and I was sharing with my immediate neighbor what is happening in Karamoja with Tororo Cement on that side, but we'll be learning from all of you what is actually happening within our entities. I know other members are still coming in who will know each other at some point. I know 2 years ago, the president awarded one of the most outstanding, I'm using the word outstanding, for mainstreaming the HIV into their sector, and that is none other than the dot services. You're welcome for that. So you can see what you're doing is being recognized actually everywhere. So you will share with actually
Nkolera mu kitongole ekya Dot Services Limited. Kitongole kikola nguudo, kizimba ebizimbe, kizimba amasannyalaze, kigezezaako okulwanyisa akawuka ka siriimu okuva mu bakozi baakyo, nga kitandikira mu bakozi baakyo bekikozesa, nga bakikola buli luvannyuma lwa myezi 3 tubeerawo n'okwekebeza akawuka ka siriimu, ne twogera n'abakozi ku kawuka ka siriimu, ne tubaprovidingira condoms, ne tubawa information what we call the Twitter IEC material basome nti oluusi akapapula akayinza n'okukatwala ewaka abantu b'ewaka ne bakola ki ne basoma. So Dot Services kino ebadde kikola not because eyina ssente nnyingi, but making sure nti abakozi beekozesa bali safe from what. That's why tubeera ne continuous sensitization ku bakozi abapya, ne tuba orienting ne tugamba you've come in this area, there are 2 scenarios. You may either oyinza okukafuna mu community mwosula oba n'okafuna ku mulimu. So tuba orienting ne tuba sensitizing and to be encouraging nti naawe bw'oba okayina, you can live longer, you can test and start on what? Medication. So yo egezezaako not because eyina nnyo, but egezaako okumaking sure abakozi baayo bali safe away from the HIV infections.